What is tuberculosis? Probably you have already heard of tuberculosis. It's one of the world's most ancient infectious diseases. Only in 2022, it has killed 1.3 million people. Tuberculosis is caused by the bacterial species Mycobacterium tuberculosis. These bacteria are slim and rod-shaped. They are aerobic organisms, which means that they need O2 to survive. Tuberculosis usually affects the lungs. However, other organs may also be affected. The disease can spread to the kidneys, brain, liver, and lymph nodes, causing different dysfunctions and even lead to death. Overall, tuberculosis is a disease with a wide spectrum of clinical features. For a long time, tuberculosis, hereinafter TB, has been considered a mysterious disease due to its elusive nature. Bacterium tuberculosis can spread via air and remain latent for years without causing symptoms. The mechanisms involved in its transmission and its pathobiology are now better understood. However, bacterium tuberculosis still represents a significant challenge for public health due to its complex behavior and resistance to treatment. If you are interested to understand more about this bacterium and find out why TB is still a global threat today, keep reading this page. Epidemiology and relevance. In 2022, approximately 10.6 million people were diagnosed with TB. Although these were mostly adults, also many children were diagnosed, 1.3 million. The seriousness of the disease becomes even more evident when we consider the death rates. In 2022, 1.3 million people affected by TB died. This is why tuberculosis is considered one of the world's biggest killers, and in fact the second deadliest infectious disease worldwide after COVID-19. Additionally, in 2014, approximately 1.7 billion people were infected by TB without having active disease. However, the death rate of TB is not spread equally around the world. The incidence of TB is strongly associated with the socioeconomic profile of a country. The majority of the new cases in 2022 were registered in 30 high-burden countries. 66.66% of all cases worldwide occurred in 8 high-burden countries, namely Bangladesh, China, Democratic Republic of Congo, India, Indonesia, Nigeria, Pakistan, the Philippines. Countries with a low socioeconomic status typically struggle with overcrowding, poor ventilation, malnutrition, immunodeficiency disorders, e.g. HIV, and limited access to healthcare and medication. These factors promote the spread and survival of tuberculosis. This shows that the epidemiology of TB exposes the global wealth inequality gap. Taking into account all these factors, we can conclude that the fight against tuberculosis involves not only diagnostic and clinical interventions, but also tackling social and economic challenges. Stages, spectrum, and symptoms of tuberculosis. As mentioned before, the TB bacteria can remain latent or progress, spreading in different organs and manifesting itself by causing a various spectrum of symptoms. The picture on the right gives a schematic overview of the different possible stages. Primary infection happens after the first encounter with Mycobacterium tuberculosis. This stage is most often asymptomatic. In this first stage, the immune system is activated and tries to kill the pathogens. After primary infection, 2 outcomes are possible: active TB or latent TB. Latent TB infection means that a patient cannot spread the bacteria to other individuals because the bacteria is in an inactive, dormant state. This stage is asymptomatic and can last for years. However, these latent bacteria can become reactivated at a certain point in life. A patient with latent TB has 5 to 15% chance to develop active TB at some point during their life. Especially patients with additional diseases alongside TB have an increased risk of reactivation. This is because the weakened immune system can enable the dormant bacteria to become active. Therefore, a reactivation risk assessment and treatment could prevent the development of active TB in these patients, as stated in an article from Nature Reviews Microbiology. Subclinical TB is a state in which the patient does not manifest the classical TB symptoms. For this reason, it is difficult to identify these patients at this stage. Active TB typically manifests in patients who are for some time in the latent state. However, in some cases, primary infection can also directly result in active TB. Active TB is subdivided in 2 categories, which are both characterized by the presence of symptoms. The 2 types of active TB are uncomplicated and cavitary TB. In active cavitary TB, the patient develops cavities in your lungs. Research has shown that this last category has poorer prognostic and treatment outcomes. The type and seriousness of the symptoms of TB depend on the stage and the spread of the disease. Although primary TB is often asymptomatic, 90-95%, some people can present flu-like symptoms, coughing, fever, tiredness. Typical symptoms in active TB are cough, chest pain, and coughing up blood or sputum. As soon as TB spreads to other parts of the body, we call it extrapulmonary TB. In this case, symptoms are determined by the organ that is affected. For example, in the case systemic miliary TB, the bacteria manage to spread over the whole vascular system. Patients with miliary TB can present with a range of symptoms such as weight loss, fever, chills, and dyspnea. Transmission and relation with protection and risk factors. Tuberculosis bacteria have an airborne transmission pathway. Because of their ability to spread quickly, many people can become infected in a short time, particularly in crowded and poorly ventilated environments. This has a significant impact on the preventative measures to be taken in vulnerable populations. When a person with tuberculosis coughs, sneezes, or speaks, small particles come into the environment. These particles are called droplet nuclei. They can travel long distances in the air and stay infectious for several hours. By inhaling the particles, the bacteria can get into the lungs of another individual. One important thing which has to be mentioned here is that only individuals with active tuberculosis can transmit the disease. Patients with latent inactive TB do not produce droplet nuclei containing infectious bacteria. Latent TB is a condition where the immune system suppresses the bacteria, preventing it from causing symptoms and spreading to other individuals. Now that you know how the disease is transmitted, let's go over to the precautions which can be taken to prevent transmission. Those can be on several levels. First of all, the patient itself can contribute to avoid spreading by taking proper precautions when coughing, practicing personal hygiene, and by using of FFP2 masks. Hospitals should also implement technical measures. Because of the aerogenic spread, patients should be held in negative pressure rooms. This means that the patient's room should be at a lower pressure than the surrounding rooms. As a result, the air contaminated with the bacteria cannot leave the room and infect other people. Finally, the visitors and healthcare workers should wear protective FFP2 masks. The risk of infection is even higher in individuals with certain risk factors. People who are immunocompromised, e.g. HIV, diabetes, malignancies, aging, have a higher risk of getting TB. Did you know that HIV patients are 16 times more susceptible to get tuberculosis? This worrying statistic is provided by the World Health Organization, WHO. However, not only immunocompromised people are at risk. In certain circumstances, even healthy people can be at risk of getting TB. Close contact with TB patients increases this chance. Therefore, healthcare workers and family members should use personal protective clothing. Another situation where healthy individuals can acquire TB is when they have latent TB. If the immune system becomes weakened due to illness, latent TB can develop into active TB. In the last paragraph, the risk of infection was addressed. This is the chance that an exposed individual becomes infected. It differs from the risk of transmission, which is the likelihood that an infected individual can pass the disease to others. There are several factors that influence the risk of transmission, such as the level of infectiousness of the patient, the environment of exposure, e.g. ventilation, and the duration of exposure. Social impact. When judging the effect of a certain disease, we should always focus on its social and economic healthcare costs, e.g. medication, hospitalization, diagnostic tests, outpatient services, etc. In this process, we often underestimate the social impact of the disease. Tuberculosis is a disease with many social consequences. It is mostly diagnosed and manifests in adults in their productive years. Many people stop working due to its high morbidity and mortality during this period. This has profound economic consequences for the affected countries. Furthermore, infected people carry a high psychological load. They often have to deal with stigma, rejection, lack of social support, depression, and eventually job loss. It is difficult to measure psychological consequences effectively. However, all these factors together can contribute to a downward spiral of poverty. Overall, the The entire medical and social context should be considered to effectively tackle the disease, not just the clinical measures.